Could you tell us how many people are entering the country each day at the moment?
As of for the period, and these are the latest numbers that I have for the period of the 16th to the 22nd of April, air passenger numbers are significantly down, and this is year on year, so this is the data that I have, by 99% compared to the same week same time last year. Maritime passengers are down by 88.7% compared to the same week in 2019, and international rail passengers are down by 94%. In terms of air passengers, 63.6% of arriving air passengers have been returning British nationals.
And what's the actual number? On the 16th of April, the Health Secretary said it was 15,000. What's the actual number now?
The actual number of people coming in as of Friday, the 24th of April, was 9,906.
Great. And what's your estimate of the proportion of people arriving at ports and airports with coronavirus?
Well, we don't have that data because it is a fact that obviously we don't have our overall approach to international travel and checks at the borders have consistently been informed by SAGE, the scientific and medical advice provided by SAGE and Public Health England. So there is no testing at the border, and that is a cross-government decision based upon SAGE advice and medical advice, and also with the Department of Transport.
You took a decision not to have self-isolation rules at the border in the way that other countries have, but I presume that was based on some sort of figures or estimates about what proportion of people might have the virus.
So my understanding is from the SAGE advice that has been given to government that the estimate was 0.5%.
And is that 0.5% of passengers arriving at airports?
That is 0.5% of the total number of people. Well, the exact number of symptomatic people is in the low tens, but I will get clarity for the committee in terms of the actual figure that is used by SAGE, because I think that is what you're asking in terms of your question.
Germany, New Zealand, South Korea, Italy, Singapore, Australia, Canada, Greece, all these countries ask people who are arriving back in the country, people are travelling home from all over the world, to self-isolate, maybe for 14 days, and we don't. And you said it's the science, but is our science different to all of theirs?
Every other country has been at a different stage in terms of the virus and the peaks in their own country. And SAGE and our scientific advice can only base their recommendations to ministers and to government based on the data that they have at a particular time. So we're going back, obviously, to that end of March period when that advice was commissioned and that advice was provided to ministers. It might be worth noting, I mean, even if you look at a country like Italy that took very restrictive measures, it did not necessarily stop the spread of the virus. So every country has been at different stages. Every country takes different scientific advice and they have to make their own judgments accordingly. Scientific advice that isolating incoming travellers, the science has been clear, SAGE have been clear to us, as have Public Health England, that this would have a negligible effect on the progression of the virus in the UK. And they've based that given on the significantly reduced numbers of passengers arriving to the country and also levels of the relatively high levels of transmission of the disease in the UK. However, I think as ever, with any decision, any policy around coronavirus, everything is under review.